I would have always pressure in my face, just constant, to the point where if I ever touched it or someone else touched my face, it would be painful. I also would have just kind of constant stuffiness. I had a really hard time going to sleep, falling asleep. I would always wake up kind of coughing, feeling like I couldn't breathe.
Chronic sinusitis is when the sinuses don't function properly. And the normal function of the sinuses is to produce mucus, to warm the air, to filter the air, and to moisten the air. If the linings of the sinuses get swollen or congested because the mucus that they naturally make doesn't get out and the air doesn't get in, patients suffer with persistent daily symptoms, which may include facial pressure, headache, congestion, postnasal drip, and chronic fatigue.
Like, I would wake up every morning and kind of really slowly open my eyes and wonder if it was going to be a good day or if it was going to be a bad day. I actually was super apprehensive about moving to the city in the first place because of my symptoms. For the first 3 years of living here, it was a huge struggle. I mean, anytime I would go in the subway, just the pollution and the dirt and the lack of oxygen, I immediately would feel myself getting more and more congested. Because my sinus pressure would always lead to headaches, I was told that maybe I had tension migraines, maybe I had allergies, maybe I had just some sort of chronic sinus infection. So for a really long time, I would use nose sprays because that was the only thing that would somewhat alleviate the symptoms, although it wouldn't make it go away. And I got a lot of sinus infections, so I would from time to time take antibiotics for that.
There are many patients who suffer with chronic sinusitis, but many people either think they have chronic allergies or even think they may have sinus issues, but think, well, this is just me. This is how I feel all the time. Patients are good candidates to go see an ENT when they have suffered with chronic facial pressure, chronic sinus problems, chronic congestion, and postnasal drip for years. For chronic sinusitis, initially patients will go on natural sinus washes, prescription nasal sprays, sometimes allergy medication when it's clinically indicated. When these simple conservative medical managements fail, we then need to take the next step. And the next step is getting the doors of the sinuses open so they function and they breathe normally. One amazing way to do that is something called balloon sinuplasty.
I feel like I've had a lot of moments over the years where I have either thought to myself or said out loud, I will do anything. I would do absolutely anything to not feel this way for one more second. So I heard about the balloon sinuplasty procedure and just got really excited because it sounded like exactly what I wanted. And I always had said, if I could just open it up and like take all the stuff out of my sinuses and just like drain my face, that would make me feel so much better. So I talked to Dr. Silvers about the procedure and I was really excited about the idea of having a solution.
Balloon sinuplasty is a minimally invasive procedure where we simply pass a balloon through the nose into the door of the sinus. We then inflate the balloon. This acts to widen the door of the sinus. The sinus will now function better, whereas air can get in and the mucus can get out, and patients' sinus symptoms are markedly improved. One big advantage of balloon sinuplasty is it can be done awake in the office under local anesthesia. Many patients, the one thing they fear about surgery is being put to sleep. So I think it's very comforting for patients to know that this is something that they can do in the office, awake, to fix the chronic problems that they've had for years.
As far as the procedure goes, it's really fast. I was done within a half hour. It's just a moderate pressure, which in no way compares to the pressure that I was feeling on a regular basis. Since the balloon sinuplasty, I feel amazing. I think I actually didn't know how good I could feel until now because it's actually been so long that I've had these symptoms that I forgot what it was like to just feel normal. So I can breathe much better. I sleep much better. I wake up more well rested even when I get less sleep somehow. I really like to run and to work out. And now I'm able to do those things until my body gets tired, as opposed to feeling limited by not being able to breathe. I just feel so much better. I have so much more energy. And it's so fun to feel like I'm just me again.